Meron akong resident na babae and somebody asked me to get the brief. And sabi ko, bakit brief? Hindi ba dapat panty? Hi guys! Welcome back to my channel. And today's topic naman ay SNF Dictionary. So, mag-share ako sa inyo ng mga terms or common words na ginagamit namin sa isang SNF. Okay? So, bakit kaya? Meron bang mga differences? Yes, guys, merong mga differences sa hospital at sa SNF na mga terms. Okay? So, I will share it with you. I will start with community. So, community, kapag hindi namin siya tinatawag na facility. Okay? So, community, we call it, facility, we call it community. Okay, bakit community? Kasi they don't like or they are creating an atmosphere or an environment for our patients not to feel na, they are patients. They're trying to create an atmosphere of having a home or it's their home, mga ganyan. Okay? So next is residents. So dahil nga they're creating like a homey environment, we don't call them patients. We call them residents. Okay? Kaya kung mapapansin nyo guys, sa previous vlog namin ni Sean, most of the time we call our patients as residents or residente. Diba? Kasi yun yung term na ginagamit namin sa aming mga patients. Hindi nyo mariringgan yung mga tao and mga staff na patient ang tawag sa kanila, but residents. Even the hospital knows that every SNF, they call patient as residents. Okay? Next is DON or DNS. Okay, so hierarchy for management, ang pinaka on top ay ED or Executive Director. Not all of them are nurses, but rather they are the head na nagpapatakbo ng facility. But the next is the DON or the DNS, which is the Director of Nursing. And these people are often nurses talaga. So, RN na talaga sila rito. Next is the ADON or ADON. They are the Assistant Director of Nursing. So, dito guys, sa SNF, konti lang ang management. Unlike sa hospital na maraming department, ang dami ding management people. Dito, we only have ED, and then DNS or DON, then ADON, and then the trainer or the EDUC, which is the CE. May mga infection preventionist din. Yan. Okay. Next is PACU. PACU, hindi ako nagmumura guys, no? PACU is Post-Acute Care Unit. Ayan. So, from the hospital, sabi ko nga sa inyo, hindi naman lahat nagtatagal sa hospital. Yung iba, kapag stable na sa hospital, nililipat na sila sa post-acute para doon sila magpa-stable or magpa-galing pa ng husto. Now, kapag medyo mas stable na sila sa post-acute, mapupunta na sila sa MFU. MFU is Moving Forward Unit or we call it rehab. Ayan. Dito na yung para mas lalo pang pagalingin sila, palakasin para makauwi sila ng bahay. Okay? And lastly is LTC, which is long-term care. Long-term care, kapag ito yung mga resident na hindi na talaga, kumbaga yung prognosis hindi siya it's either medyo pangit or matagal pa yung caring ng yung medical care needs nung resident. Okay? Pwede din, ito yung literal na nursing home na pwede kang magpa-admit dito kapag yung wala lang talagang mag-aalaga sa'yo sa bahay and you have certain conditions. Yan. Diyan na pupunta yung mga residents na ganon, which is long-term care. Okay? Next is EDK. EDK is Emergency Drug Kit. Okay? For sure, meron tayo yan sa Pinas kasi lahat naman ng mga hospital and facility meron ito. Emergency Drug Kit, sa amin, we call it Omnicell. Yun yung brand ng pinaka-machine And dito kumukuha ng mga stock meds kapag walang available na meds dun sa med cart nyo. Next is med cart. So, med cart is the cart kung saan nakalagay yung mga medicines nyo, NARC box nyo. So, NARC box is the narcotic box kung saan nakalagay ang narcotic meds. Okay? Next is treatment cart. Treatment cart is the cart kung saan naman nakalagay yung mga pang-treatment nyo. Like dressings, cream, ointment. Yan. Diyan yan nakalagay. Next is treatment. We call treatment yung mga para sa mga wound treatment. Ayan. So, pag narinig nyo, done na ba yung treatment mo? Ibig sabihin, nakapagpalit ka na ba ng dressing, nakapaglinis ka na ba ng skin na yon, kung ano man kailangan ng linisin, mga ganon. Okay, that's treatment. Next is GTUBE. So sa atin guys, usong-uso ang NGT or nasogastric tube. But dito guys, most of them uses the GTUBE or the gastric tube. Diretso na siya sa tiyan, hindi siya sa ilong. Okay? Dahil may GTUBE, meron din tayong kangaroo pump. Kangaroo pump is the pump or the enteral feeding pump na ginagamit para sa feeding. Ayan. Okay, next is the wound vac. Wound vac is a vacuum-assisted wound therapy. Wound vac, para to sa wound. Okay. So, gumagamit sila ng pressure to promote wound healing. Ayan. So, next is STERI strips. STERI strip, for sure, meron tayo nito sa Pinas, sa mga nag-OOR. But for those na hindi alam, ulitin ko lang, STERI strips, it is a tape for wound. So, ginagamit siya kapag nagtanggal na tayo ng suture, ng staples, yan. Nilalagyan ng STERI strips. And yes, guys, as RN, nakakapagtanggal tayo ng sutures or ng staples dito. As ordered, syempre dapat. Next is code silver. Pagpasensyahan nyo na guys yung ingay ng background ko Code silver, ito yung mga, kung may code blue tayo for nag-a-arrest, code silver ay mga residents or patients na nagiging aggressive or nagiging become violent na, you know, na kailangan to watch out. Okay? Next is WANDERGUARD. WANDERGUARD, it is a device na nilalagay sa either wrist or sa paa para mag-alarm kung ito yung mga pasyenteng may risk for wandering or lumabas ng building. Ayan. Para siyang yung alam yung kinakabit sa department store sa damit. Nag-a-alarm siya kapag pumunta ka dun sa area yun. Kumbaga may restricted area lang na hanggang dun lang sila pwede. Okay? You call it WANDERGUARD. Next is PTO. So, for those na nag-work sa BPO, they know what is PTO means. Okay, that's paid time off. We call most of the time sa Pinas na leave, VL, SL, ayan. Dito, tinatawag nilang PTO. Next is PICC line. PICC line is peripherally inserted central catheter. So, sa atin, IV line most of the time. Sa SNF, hindi madalas ang IV. Madalas dito, PICC line. Si PICC line, sa central vein na siya, diretso. Pero ang difference niya, para siyang perm cat, pero ang difference niya yung type of catheter. Okay? So, next is brief. Brief is diaper. So, ma-share ko lang no guys, nung unang pasok ko dito, meron akong resident na babae. And somebody asked me to get the brief. And sabi ko, bakit brief? Hindi ba dapat panty? Kasi babae siya, di ba? Yun. So, hanggang sa nalaman ko na degrading daw kasi kapag sinasabing diaper sa isang resident or sa isang patient. So, they call it brief. So, mapalalaki, mapababae, ang tawag nila dyan sa diaper ay brief. Okay? So, next is bubu. Bubu ay isang poop. Ayan. Medyo, ano yan one of my new learning sa isang residente ko. Okay? They call it bubu. And nalaman ko lahat pala ng Americans alam ang bubu. Sa atin kasi pupu. So, sa kanila, bubu. Yun lang yun. Next is NARC box. Nabanggit ko naman kanina, di ba? NARC box is narcotic box. Next is Yankaeuer tip. Yankaeuer tip is the suction tip for mouth. Okay, ito yung parang naka-curve na tip for suctioning. So, hindi siya ginagamit for trach. Okay, may ibang catheter for trach. So, si Yankaeuer tip ay for mouth. Okay, so correct me if I'm wrong if it's Yankauer or Yankaeuer tip. But I usually hear Yankaeuer. They call it Yankaeuer. Okay, next is PD. PD or peritoneal dialysis. So sa atin sa Pinas, we call it peritoneal dialysis. But here, they call it peritoneal dialysis. Ayan. Dapat maarte. Peritoneal dialysis. Yan, okay? So, peritoneal dialysis, ito yung counterpart ni hemodialysis, which is gumagamit ng peritoneum para doon mag-take place yung dialysis. Okay? Next is dwell time. So, for those na hindi marunong sa PD or sa peritoneal dialysis, there are 4 steps in or 4 phase in a PD. Okay? Lagi yan ibang company, kahit anong company yan, may 4 lang naman na concept. Apat na steps sa PD, which is the drain, flush, fill, and dwell. Okay? Drain is para ilabas yung solution na pinasok sa pasyente. Flush is to flush the line. Fill is to insert yung solution sa peritoneum ng patient. And then lastly is the dwell time. Dwell time is doon na nagte-take effect ang osmosis or the dialysis itself. Okay. Next is exit site. Exit site, ito yung kung saan nakakabit yung PD catheter. We call it exit site. Okay? Next is effluent. Effluent is the fluid being drained from a PD patients. So, syempre, sabi ko nga sa inyo, we have 4 steps in PD. The drain, flush, fill, and dwell. So, pag nag-drain tayo kung ano yung pinasok natin solution at nag-drain tayo ng excess water of the patients, we call it effluent. The fluid na nilabas sa residents, we call it effluent. And last but not the least, POSIFLUSH. POSIFLUSH is a prefilled saline sterile syringe. So, ito yung individually packed na syringe na ang laman ay saline, pang-flush ng saline, pang-flush ng mga lines, PICC line, ganyan, para, to maintain the patency of your catheter. Okay? So, yun lang guys, ang ating SNF dictionary. If ever meron pa akong maisip or may madagdag or whatsoever, I will just do another part 2 of a SNF dictionary. And I hope marami kayong natutunan sa aking SNF dictionary, and probably I will just make a separate video for those na kailangan ng elaboration on how to use it or para saan yun. Okay? But if you like this video and you like more of it, please don't forget to like and subscribe. Bye!